We are live. Hi class, this is teacher Tammy and we are at McKinley Orthopedic and Sports Medicine, one of your clients here in Fairbanks, one of their locations. And check it out, we've got Tim here, he is the owner. He's going to take us on a tour.
Welcome guys. So this is obviously the parking lot and the sign out front. We're going to walk right through the front door to where the patients come and check in. So we'll come through the front door, you'll see a couple. We take care of a lot of wounded people, so we have some wheelchairs and such to pick them up and meet them at the front door.
There's his name on the door with all the other providers.
So you walk in to start with the waiting room. So here we pretty much operate three different businesses. There's the orthopedic clinic where we see patients routinely. We have a partner with ATI that does our physical therapy. We have an imaging center that does MRI and X-ray. And we have a surgery center that does all of our surgical procedures. As you can see, we partner with you guys. We take care of pretty much all of your athletes come through here, and we have physicians and trainers at pretty much all the NANOC events, mainly the hockey, but we try to be at all of them. So
look at this, overall best doctor, Tim.
Yeah, that thanks to Newsminer last month, so we have to find a way to promote that eventually. So this is the front desk. We call it the horseshoe. Depending on which part of the clinic you're checking into, when we get busy, there'll be 6 or 8 people here checking people in and getting all their information. A lot of information gathering goes in here to, kind of, it's a lot of paperwork and computer work collecting the business end up front, and then we go back to the patient care stuff.
And we chatted earlier about why are there so many seats in here, and what did you tell me?
It depends on the day, but for example, this week we have the Shriners Clinic coming in, so we'll probably have 100 kids that come through here that need help from physicians all over the lower 48, just as a charitable outreach to take care of them. So on certain days this place will get really busy, just kind of depends on the day.
All right, let's see what else we have here.
So we'll start just with the clinic side. I'll show you an average exam room. So most patients, if they're just coming in for broken arms, cast changes, getting ready for different appointments, this is what they'll see. They'll check in and they'll come in here and they'll spend most of their time in this room. So the best part about my world is I take care of everything. My last clinic I did a 2-week-old and I had a 102-year-old that came in. So we get the wide variety of everybody, which does make it a challenge when you're trying to market to them, because not all of my patients use social media, so we have to have different ways of outreaching to them. So the clinic rooms, there's 12 of them, kind of come all the way around in a horseshoe as well. So it's one giant U that we walk around. This here is our, we call it our physician assistant closet. They call it a closet because they do all the work and there's no windows. But this is where all the people that really take care of us so that we can do the surgeries and take care of people kind of work. We have the kind of the manager bosses here with glass on each side so they can hear all the problems and pick up on things ahead of time. They're in trouble already. All right, and then we'll go, we'll walk through the therapy place. I don't think there's anybody in, but one of the main things that, as you look at the signs there, another thing we do is we take care of all the high schools. So we employ 3 trainers that basically live at each of the high schools just taking care of athletes. And that's all of the community service from us to the North Star Borough and Monroe.
Cool.
So this is the physical therapy clinic. A couple people in here doing some stuff, but mainly in our world, I would say about half of the people that come to our clinic don't need surgery or don't need extra things. They just need the physical therapy aspect. So having them here to do this is a huge advantage. One of the things we're trying to promote is when I first got here, you would come to see me and then I have to send you somewhere else for your MRI. I'd have to send you somewhere else for your physical therapy. I have to send you somewhere else for your surgery. Somewhere different for your labs, all these different things. And it was very hard to get people back and forth, and it took a lot of time, especially if you lived in Delta or Toke or somewhere different. Sure. And now we try to do that all here. the other side of the clinic. One of the other things, so we have surgery. We also have osteopathic manipulation. I don't know what room is the best one.
Explain that for students who are
osteopathic-
younger and don't know.
Yeah, so osteopathic manipulation is where we basically use manual medicine to reset the patient's alignment and body to help them heal themselves. And it's a very popular thing. As you can see, Dr. Malcolm's our main sports medicine doctor. She trained and ran Notre Dame stuff until she came here. So UAF does not like that, even though they don't play there anymore.
Yeah, go Irish.
They're trying to get the Notre Dame stuff down, but we're just waiting for UAF pictures. More of them.
Well, the chancellor's from Notre Dame, so it's okay.
Yeah.
Oh, break room. You'll never
Yep.
see that as a patient, but
No, never see that.
take care of their employees here.
But we'll sneak in here. This is our. Okay. So this is our X-ray facility. It's always a little dim, so we can see
Yeah.
the lights where the X-ray goes. But the X-ray happens here, and then if you need more than an X-ray, another nice part is we have a full MRI here. You got to be careful with your phones in here. It'll wipe your phone clean pretty quickly.
Okay.
So it's not open now. Oh, you can come right here.
Okay.
It's fine. But when this opens,
Holy heck.
it's a patient lift and a whole MRI. I might as well. I can show you real quick.
Okay. Did not expect this. Let's see what this is all about.
So our counterpart down in Wasilla, to know how strong these are, they took the wrong wheelchair in, and they had to bring in a crane to get it out because that's how much pressure it is. Because if the wheelchair is metal, it'll suck it in because of the size of the magnet.
All right, going up. And the big reveal.
All right, so let's see. I don't know which one.
Holy heck.
So that's the door. I would stop there, not
Okay.
get too close.
There we go.
But yeah, this is where patients come in, and that's the magnet there. It's pretty much a whole bunch of electrical equipment in here that runs the, runs the magnet. The cool thing about the magnet is even when it's 40 below, it melts everything because it's so warm. 40 below doesn't even touch. We still have to cool it.
Okay.
All right, and now we're going to walk into the last place, which is the surgical facility. So if you're a patient, you're going to come, be brought back here. This is where you're going to check in and get changed for surgery.
Don't be nervous. You're
Nope.
going to be better after surgery.
We have one room that's a little bigger. We do have the ability to keep you overnight. We don't do it very often, but we do knee and hip replacements and spine
Oh my
surgery.
goodness.
So you can spend the night here if you really want to. But most of our stuff goes home. Show you around the operating room real quick. So
Authorized personnel only. We have VIP access.
you do. When you come this early, you do. So basically the patient flow here, I gotta find the lights again. But we come into the operating room, we're set up, we're gonna do a bunch of spine injections this morning. So that's what it's set up for today.
Okay.
But the patient will come in here, have their surgery, and then when they recover, they come kind of this way, and then this is our flow. There's a little light. So the patient gets their surgery performed there, and then they come out this way. I'll get some more lights for you. This is where the nurses are.
The what are?
The nurses are
Okay.
here, and then this is recovery bay 1.
Okay.
So we recover here. We can recover here depending on what equipment we're using. This is all our, most of what we do is arthroscopic stuff. So
Okay.
little incisions, rotator cuff repairs, ACL
Yeah.
stuff, different things through little incisions. And then the patient comes right back through here. And back to recovery. Just some fun stuff, like if we use standard, sterilizing equipment. It looks just like a dishwasher, but it's a lot more expensive.
Oh.
So the equipment comes in here, and then it goes through that window there, and I'll show you the last little bit of the process. Excuse our broken bed. And then this is where everything gets sterilized and cleaned.
Yeah, it looks really clean. Of course, one would expect that,
Yeah.
but I can attest. Very nice. Well, thank you for the VIP access and the
Yeah.
tour this morning.
It's our pleasure. Thanks for helping us out with our marketing.